Sure, you can always shop around for flooring, but in the end, it all leads back to the one place you probably should have started, the experts at Carpet One. Save yourself the time and the hassle and let Carpet One help you find the right product at the right price. Beautifully installed, guaranteed. Come see the One, Carpet One, on the Business Loop in Columbia.
Good morning and welcome to Radio Friends on this Friday, March 18th. We have with us today Heather Harlan from the Phoenix Health Programs. And Heather has her ukulele with her.
Yeah, you know, it's just any chance to help people remember things and learn.
And you're doing that with the ukulele?
Yes, I'm doing that with the ukulele today.
Okay. How does the ukulele play into the...
I'm always, at Phoenix Health Programs, first of all, we're celebrating Brain Awareness this week at Phoenix because...
Brain Awareness?
Brain Awareness Week. Substance use issues are a chronic brain issue, health issue. So I really want people to understand that. I just found a little tune that helps explain a lot more about substance use issues and how they develop. So this is your neurological science lesson for the day, Paul.
Okay, all right.
So you can remember it. What's rewarded gets repeated, yes, it's true. What's rewarded gets repeated, yes, it's true. We reinforce and affirm so young brains can learn. What's rewarded gets repeated, yes, it's true. Now, we know what happens sometimes. What's rewarded gets repeated, yes, it's true. What's rewarded gets repeated, yes, it's true. But alcohol and drugs can change the neural pathways in our brains. What's rewarded gets repeated, yes, it's true. So that's how human brains grow. We get rewarded for things, and then we repeat doing them. So drugs and alcohol are very easy reward. You don't have to learn anything.
But when you do drugs and alcohol, doesn't it do something to the brain? Doesn't it rewire the brain?
Exactly. And so that's what happens. It changes. It's a physical change in the brain. This is not a moral issue. It's a physiological issue that we can see under the microscope, a physical change in the brain.
And I think you also taught me years ago that the younger you are, that you start using drugs and alcohol, the more susceptible your brain is to rewiring itself, and not in a good way.
Right. Then it just goes to, it's for the very simple solution, which is to use the chemical to feel better. You don't have to go to bed on time or get a job or learn new skills or learn how to do social amenities or get along with people. You just use the drug. And this is for adolescents who haven't learned the other skills. So 90% of addictions begin during adolescence. So what do? Right?
Yeah.
Well, here's an example. 17-year-old client that I had some years ago that he smoked a lot of pot. He liked smoking a lot of pot because he got a lot of rewards on his brain. So I said, well, what do you get out of smoking pot? He said, well, I relax, I laugh a lot, and I hang out with my friends. I said, well, you're 17. You should relax, laugh a lot, and hang out with your friends. Is there any other way to do that besides smoking pot? He didn't really know. So the way we do treatment at Phoenix Health Programs with Project Apex...
He didn't know because that's all he's ever done.
That's all he'd really done. That was the easy way. Hey, I can laugh, hang out with my friends and relax, and that's the way I do it. He didn't know. So what we worked with a community reinforcement approach for youth. It's a different way of doing treatment, community reinforcement approach. I invite your readers to look it up. The old way of doing things has been to just turn up the heat. If a young person's having problems, turn up the heat. We're going to punish them. We're going to pile on the difficulties and the discomfort until they stop. This is a way of rearranging the contingencies in the reward system in a young person's life so that not using becomes more rewarding than using. That takes time. It takes guidance because most of us don't know how to do that, which is why the parents or friends or significant others are also involved in this so that they can learn new ways to encourage the positive behavior, because we know what's rewarded gets repeated, yes, it's true. What's rewarded gets repeated, yes, it's true. We reinforce and reaffirm young brains so they can learn. What's rewarded gets repeated, yes, it's true.
Now, we're talking about young people, but as we grow older, does the alcohol and drugs have the same effect on our brain or less?
Well, it depends. There reaches a point where we may be on, as we get older, medication and muscle mass decreases, so that those perhaps alcohol or other drugs we might have used without any impunity become more of an issue because it affects us more. We tend to, it just depends on the individual. There are a lot of factors that influence it, but that's one thing that we see as older people sometimes get caught off guard because it wasn't a problem before.
What is the biggest problem you see in young people right now as far as drug and alcohol?
I think the biggest thing is that it's available easily to young people, that we see it as a rite of passage.
So if it's not a rite of passage, what is it?
Well, this is really a public safety and health issue, to reframe it for young people. So earlier interventions give better results. We know that with cavities, we know that with all sorts of things. So this is a chronic health issue. When these young brains are exposed to these chemicals, it causes almost like a chemical trauma in the brain. And again, then what's rewarded with those chemicals get repeated, so that behavior does.
Okay, it sounds simple, but how do you get this message across to young people?
I'm really speaking to the adults, Paul, because young people's brains are not made to hang on to this information. It's about managing the environment where the decision is made. Young people don't manage their own environments. We adults do. So one of the biggest challenges that we see are adults bringing children in soon enough when there's been any drugs, any alcohol, any marijuana in the picture at all. Even just tobacco is a reason enough for mental health screening, so that we can help people get on the right track early.
If you're talking to parents right now,
yes,
they're watching and they
coaches,
suspect
yes,
that something is going on, what's the best way to approach the kids without turning them off?
Right. I think the first thing to do, the free, no cost, call me, let's talk. Let's strategize. Let's talk about what's going on, because there's strategies that we can help you with as to how to approach your young person. They don't even have to believe they have a problem for us to help them. It's really the community reinforcement approach is a very different way of doing treatment, and with Project Apex at Phoenix.
Okay, so if you have any questions
yes,
at all,
that's the easiest
they can
way.
give you a call.
Yes.
What's the telephone number?
573-875-8880, extension 2142, and it's phoenixhealthprograms.com on the web, and we're on Facebook too.
Yeah, and you also have, is it once a week on Monday nights?
Yes, we have Monday nights, 6 to 8, a free family and friends group. Anyone in the community can come. And also on this Saturday, March 19th, and on the 26th, from 2:30 to 3:30, we have a free family group just for family members. That, again, is open to anybody in the community.
So what's going to be going on with the family group?
Again, it's changing the environment where the decision is made. So family members need help because they don't know how to help someone whose life is on track and is focused on that reward system of chemicals versus the reward system of positive and pro-social skills.
Yeah. And you can feel like you have your back up against the wall.
Yes.
You don't know how to handle it alone. Keep in mind you are not alone.
Yeah, 573-875-8880, extension 2142.
Heather Harlan, thank you so much for coming by. We're out of time for today. Our program directed by Travis McMillan of the Reynolds Journalism Institute. Audio is Trevor Harris from KBIA. Our floor director, Ariel Sierra. And our assistant producer and guest coordinator, Uncle James Mauser. Monday, we're going to talk about our African origin. Have yourself a good weekend. We'll see you Monday. Bye-bye.